The only way to solve the mental health crisis is by working together. Thank you for joining us on a mission to save and improve lives. Let's start with a statistic that you may already be familiar with, but is important to frame our conversation. 69% of those suffering from a mental health condition did not know that the symptoms they were suffering from were caused by their mental health. Said another way, 69% of those suffering from a mental health condition complain of only physical symptoms, such as back pain, neck pain, vomiting, etc. That means that we are focusing our efforts on the third of patients that can articulate what is happening with themselves. But a full 2/3 of patients are not getting the help they need because they are unable to articulate what's wrong. Traditional methods for uncovering these mental health issues are like fishing with a fishing pole. Basically, you have to know what you are fishing for to bait the hook. Maybe you think the patient is sad, so you give them a PHQ-9. Or maybe they seem anxious, so you give them a GAD-7. But mental health doesn't work that way. It's a spectrum, especially since most patients aren't even aware of their own symptoms. That's why we built our tool to fish with a net. We throw a net in the water and see what comes back. That's how we bridge the gap between primary care and behavioral health. Most patients don't go to behavioral health on their own because they don't know they have an issue. And that's why most mental health conditions are caught in primary care. Connected Mind is made up of two distinct sections. This is important not only to elevate patient care, but also because it changes what you are able to bill insurance. The first section is screening. Think of it like a funnel. The top part of the funnel is tuned to maximum sensitivity. We ask 8 yes or no questions in random order. That means every time the patient takes the screening, it looks slightly different. This typically takes about a minute. From these 8 questions, we are able to rule out the 6 most common connected mental health conditions with a 96.4% negative predictive power. That means that less than 4% of patients will slip through the cracks if something is going on. If a patient answers yes to any of the screening questions, then we switch from screening into testing. The testing section utilizes SAMs, or standardized assessment modules, run through an automated intelligent branching logic engine. It is very similar to being interviewed by a clinical psychologist. By doing it this way, we are able to eliminate redundant and unnecessary questions and focus just on what is indicated for that patient that day. It typically takes between 2 and 5 minutes. What you are seeing on the screen is obviously a severe case, and this would take between 10 and 12 minutes. When the testing is complete, the provider receives the Connected Mind results instantly in their EHR. The top portion shows scores and severities for longitudinal tracking. The middle portion shows whether or not the patient meets standard criteria for the condition. The bottom portion shows additional factors that may be causing the patient to feel the way they feel. So the patient is telling you, I want you to know, I have life events, bereavement, drugs, alcohol, illness. Something else is going on, and they're letting the provider know that they think that may be a factor in how they are feeling. For the 2 tests where people tend to be less than honest or not pay attention, we have a consistency score. The closer to red, the more likely they are not being honest or not paying attention. The closer to green, the more likely they are being honest and paying attention. We are able to screen for bipolar in the general population. However, the default setting is to screen for it in the presence of depression. This is a protection to make sure that a patient who is suffering from bipolar depression is not put on depression medication, sending them into a manic or hypomanic episode, which could be deadly or worse. Since suicide is comorbid to all these conditions, not just depression, we check for suicide risk regardless of what gets triggered. If there is suicide risk, we look to see if it is ideation, risk factors, or if there is an actual plan and intent. Areas of concern are in red. Your eyes are meant to be drawn to the things that stand out. Most providers can intuitively interpret the test results at a glance. There are two ways of administering the test, either through a tablet in the waiting room or with a remote link for telemedicine. The tablet is used as a kiosk. You simply hand the patient the tablet. They choose between Spanish, English, and Vietnamese and answer the questions. Unlike traditional systems, when they hand the tablet back, it is immediately ready for the next patient. If the patient receives the remote link, they can complete the screening on any device, a laptop, a desktop, or even their cell phone. In both scenarios, results are instantly uploaded to the EHR. Our interface takes less than a minute to set up and works with every major EHR. Let's focus on billing for a few minutes. We make it easy. For every single individual encounter, we produce a billing guide automatically. It details exactly how to bill and document each unique encounter. For example, this guide details Sally's visit to her doctor. Her results have been ruled out in the screening process. You'll notice that we use CPT code 96127 with a modifier 59. And we use 3 units. Unlike the PHQ-9 or the GAD-7 that are only allowed to bill 1 unit which pays about $5, we can bill 3 times that much. You'll notice that we use a Z code for the ICD-10, and that's because 96127 does not require medical necessity. Screening is meant to be applied to the general population. We also give you the charge, which is 225% of Medicare allowable. We show you which modifier to use on the E and M 25 and instruct you to never use the same ICD on the E and M as you do for mental health, to prevent insurance from bundling the codes. We show you the documentation and where in the narrative that documentation should go to ensure that insurance sees it as separate from the E and M. If during the screening process the patient triggers at least 2 conditions, positive or negative, instead of billing the 96127 you bill 96138. This code requires medical necessity. Medical necessity is provided by the screening and from what happens in the testing. 96138 pays about $35. The proper documentation is provided. Notice that this is a time-based code, but it is not face time. It is total time. That includes a technician handing out the tablet, the patient taking the test, receiving the tablet back, doing the documentation, and asking if the patient had any issues. If the patient is positive for at least 1 condition and the provider reviews the results with the patient, documents their clinical decision-making, does a treatment plan, and gives the patient an opportunity for interactive feedback, you can bill 96130. 96130 pays about $120 and has a different set of documentation, which we provide. Notice that it is a time-based code, but it is not face time. It is total time. If the patient triggers both testing and at least 1 condition is positive, you bill both 96138 and 96130. This pays about $155. We provide you with both sets of documentation required for this example. Most providers schedule a follow-up visit for 96130 to ensure that they are able to spend time reviewing the results with the patient. This also provides them the opportunity to bill for an additional office visit. Here is an example of an ROI for a single provider seeing 20 patients per day. 75% of patients triggered testing. 50% are positive for at least 1 condition. This assumes that reporting is done during a follow-up visit and not on the day the test is administered. To be conservative, we are showing the lowest level E and M. This is not a guarantee of results, but shows that, at minimum, the tool more than covers its cost. That's it. Connected Mind offers better care for your patients and better care for you and for your staff. The tool saves you time, seamlessly integrates into your workflow and helps you get paid for work you are already doing. Know your patient. Know the big picture. Know your plan. Thank you for joining us on a mission to save and improve lives. Learn more at connectedmind.me.